So we're going to look at this foot model that we have in the lab. A couple of landmarks to be aware of. This is the tibia, and this is the fibula. Right? We've got the hallux up here, and the fifth digit, or the digiti minimus, here, which makes this a right foot. So using the bones as a landmark, just anterior to the tibia is the tibialis anterior muscle. Over on the opposite side is the extensor digitorum longus muscle. And then sandwiched in between those two, with this blood vessel and nerve running through it, is the extensor hallucis muscle. So extensor digitorum longus is going to extend digits 2, 3, 4, and 5, right, which is basically an uncurling of those toes. Extensor hallucis longus is extension of the hallux only. On the lateral compartment, lateral to the fibula here, we've got two muscles. Fibularis longus is this part with the longer tendon running through here. And then fibularis brevis is just deep to it, slightly larger muscle belly, and the muscle runs on either side of the fibularis longus tendon, but fibularis brevis is going to come the same way. Those are both everters of the foot, so bringing the foot out this way. On the posterior compartment, what we can see most superficial is the calcaneal tendon with just a hint of soleus muscle fiber. Right? Gastrocnemius would be even more superficial to this, but it would be so much more proximal that it's not even included on the model. Just behind the tibia is tibialis posterior, and then posterior to the tibia but also on the medial side of the foot is the flexor digitorum longus muscle, which is going to flex digits 2, 3, 4, and 5. So because it's on the medial side of the foot, that tendon has to come down and then cross underneath the foot, underneath the arch of the foot, to get to those digits. Okay. Likewise, we've also got the flexor hallucis longus muscle, which is going to come down. Flexor hallucis longus is going to come down, and its tendon is going to cross and stay medial so that it comes just to the hallux. Then a few muscles that are intrinsic to the foot. Looking at the dorsal side of the foot, we can see these pink structures, which are representing muscle bellies. So what looks to be 3 bellies here is the extensor digitorum brevis muscle. So it's the shorter version of extensor digitorum longus. It's going to extend digits 2, 3, 4, and 5. Over here, this longer muscle belly, which is crossing over, kind of pointing towards the first digit, is extensor hallucis brevis, and it's again just going to help extend the big toe. On the lateral side of the foot, you see a small muscle belly here. This is abductor digiti minimi, or abductor digiti minimi. And on the medial side of the foot, we have an abductor hallucis, abductor hallucis. And if my hand was going to represent what those muscles do, abductor hallucis would pull the first digit away from the midline of the foot, abductor digiti minimi, just the 5th digit. So if you could do them together, they would spread your toes out. And then the last muscle that we need to talk about is underneath this connective tissue, underneath those tendons. We've got the flexor digitorum brevis. Right? So flexor digitorum longus was in the leg in the posterior compartment. The brevis is here on the plantar side of the foot. And that's going to flex digits 2, 3, 4, and 5, just like all of the other muscles with digitorum in the name.